So obviously, we have a lot of things to be proud of, but we did have to make a lot of really hard decisions during this time as well. So maybe touch on some of the hardest maybe decisions we had to make, or hardest things that you had to experience, and lessons learned from some of those things.
No visitors. It was horrible.
Visitors was, that was hard.
That was the worst thing to experience, not being able to be with your loved one. And of course, we tried to put ourselves in their shoes, so we had iPads, we FaceTimed, we had a voicemail set up, and we had all different avenues to be able to communicate with families, but it's still not the same as being there. And that's a challenge to the healthcare provider as well, because that's part of taking complete care of a patient, is the communication with the family and that relationship that you build. So that was definitely something that I was glad was over when we brought back visitors at a limited capacity. But I'm glad that we stuck through that with all of the COVID surges and allowed the families to take part in the patient's care.
Right.
I'm going to have to take that one as well. And, one of my areas is hospice, and so we have the Flo and Phil Jones Hospice House. And, I remember the day that, me and the director had the conversation we had to make to not allow visitors. And that was tough, because you're talking about, end of life, and you've got family, and, you've got kids and grandkids, and everybody's wanting to come in. And we had reached a point to where we just couldn't allow that. And so how do you allow this for one family but not the other? And people are coming in from Tennessee and Oklahoma, and you go there and they're standing in the parking lot, and you really can't do anything. And you walk through the hospice house, and there's families there, there's food. It's joyful, joyful in the life as people are celebrating life. And then during COVID, you go in there and it's just empty. So that was probably still one of the toughest decisions during that time for me.
And on top of that, the emotional toll that takes on, like, the nursing staff, restorative therapy staff, Brett Vincent that's running around here, that was our family liaison. That was the hardest thing for me, just seeing people that I work with and love and think of as family just like suffering, you know what I mean? Because it doesn't make us feel good to be circling around a patient that's dying and the family not be there. You know what I mean? We took that very passionately. And the way we set up the process of putting somebody on the ventilator was a nurse sitting on the side of the bed holding their hand while we're getting ready. And I mean, you do that day in, day out. I mean, there would be times we'd have 4 to 5 people die in 5-hour time span. Mm-hmm. Man, the emotional toll that it took on my friends and family, that was tough, that I work with every day, and I just love so much. That was the hardest thing for me.
Yeah.
Yeah, and from my perspective, I don't do direct patient care like these guys do, but towards the end of Omicron, when we started seeing the supply chain shortages, and the monoclonal antibody treatments became very limited. We would have more patients that needed treatment than what we had treatment.
Right.
And so having to work with the providers, looking at patient charts, trying to decide who was at the most need, and then having to just say we don't have any more, even though we would try to drive to Northwest Arkansas to get what we could, drive to Little Rock. We did everything that we could, but there were still some that we couldn't treat based on the criteria that's been given to us.
And on that, one of the hardest things, and we had to do this, like, I don't remember who made us do the rationing of care.
Right.
So, yeah.
Right.
Signing that piece of paper, that was probably the hardest thing I've ever signed, that essentially said, if you've got X number of patients, but you only have X number of ventilators, who gets it and who doesn't. And we were delegated by the government to come up with that. That was the hardest piece of paper I've ever signed. And by the grace of God, we came very close a couple or 3 times of running out of ventilators. But I remember one time Chris Barber went and got just a little bit of money from the state, and the first thing we did, what did he buy, 15 ventilators?
Yeah.
Like every dollar we got from the state went towards protecting the region. I mean, it did. But that was the hardest thing I signed.
I know. We never had to make that decision.
We never had to make
just
the decision, praise
thinking
God.
about what if we had to, and knowing that there were places in the country that were having to make that decision. Yeah, that was tough just to even think about that possibility.